see, in this, you can see that definitely there are multiple mechanism of action that has been shown over here. But let's start from the very beginning, how it starts acting. You all know how the molecule enters the brain, how the metabolism is happening, how the excretion is happening, everything now you are well aware of. Now remember, this itself is very important because the metabolism actually has multiple point of action. So sorry, the metabolism takes place, but the mechanism of action by which it acts actually is through the proteonomic interaction. So let's write down and let's make a table out of it. Always remember that lamotrigine therapeutic action is a proteomic interaction. Okay, how? Now see, first of all of you know this. Sodium is there, calcium is there. This is your glutamate receptor. No, sorry, this is your GABA. This is your non-selective cation channel, number 4. Okay, this is your ion channel, cation channel. If you want, you can remember this, but let's try to understand from the very beginning. Now see, lamotrigine is a blocker of voltage sensitive or voltage gated sodium channel. VGSC. Okay, remember this. When does it bind to this? It binds to this particular channel. Okay, lamotrigine binds during fast inactivated state. What does it do? It slows the recovery. And by slowing down the recovery, it stabilizes the presynaptic neuronal membrane. Now see, what does it do? This is the key thing which is happening. When it stabilizes, it does multiple things. Now there are downstreaming proteomic events which are going to happen. Now, see, what are these downstreaming proteomic events? The first of all is, see, it does lead to inhibition of pathological release of excitatory neurotransmitters like glutamate and aspartate. This is the first thing it is doing. Second part, modulates GABA, GABAergic transmission. Okay. Now, if someone asks you what is the role in serotonin and other set of, number three, weakly binds to 5-HT3 receptor and blocks it. Okay, these are the important things. But uh, it does not have significant. Just add on this point. Does not have significant role in norepinephrine, dopamine receptor, norepinephrine receptor. It doesn't have that much role. Remember. Now, after having known through this, let's look into some deeper aspects of mechanism of action, because this much mechanism of action everyone knows. You should be knowing something more. Okay, you should be knowing something more than this. Now, see, first of all, pharmacokinetically, if we say, if I just have to add on one line, just over here only, you can just write it down. It follows a first order kinetics. Lamotrigine follows first order kinetics. Okay, that is what you should be knowing. Next, after this, you should know that, see, after following this first order kinetics, it is extensively metabolized, that you have seen, and now it get uh, released via the renal excretion, the lamotrigine N2 glucuronide. Now see, downstreaming pathway affected by lamotrigine are as follows. Now see, first of all, it causes, it might sound very odd to you, but downregulation of MAP3 kinase. It happens. Okay. This is related to tau phosphorylation. So it doesn't allow this tau molecule, this tau particle to settle down, thus provides neuroprotection. Also, FOSB. FOSB, this is related to microglial inflammation. So it's an anti-inflammatory drug. Okay. Now, it causes upregulation of PTGD and CD74 marker. Both of them are involved in metabolism of A beta particles. All of you know that if they accumulate, this can lead to dementia. So that is how they are actually doing the neuroprotection part. Okay. Now see, so it decreases the plaque formation. So both of them actually does neuroprotection. These two actually sum up towards formation of a neuroprotective agent. Now, with this, let's add on three things. Neuroprotection, if someone asks you how, so you can say that decrease plaque formation and it decreases level of phosphorylated tau protein. Okay, now cytokine changes. Yes, it does happen. Cytokine changes. What happens? There is decreased neuroinflammation, and it has been seen that there is decrease in level of interleukin 1 beta, interleukin 6, and TNF alpha. All of these are pro inflammatory markers. With lamotrigine, there is a reduction in these levels. So, immunomodulatory effect is also noticed. Okay. Now, number 4, manages or elevates level of synaptophysin. Synaptophysin, what is it? It is a synapse marker of, it's a synaptic marker of synapse preservation. So you can see not only it is inhibiting the sodium, but there are multiple downstreaming pathways which are getting altered. Okay, and as a result, brain is achieving more stability and less of chaos, less of inflammation, more of stability, more of neuroprotection, more of a controlled and a very regulated way of functioning. That is what it is going on with this. Okay, now if someone asks you what is okay, if there is a decrease in level of these neurotransmitter, then does it increases some neurotransmitter? Yes, it does increases. It does increases level of interleukin 5, IFN alpha, IFN beta, IFN gamma. All of these are anti-inflammatory. Okay, remember this. Now, after having a look at this, let's look into one more channel that we have missed over here. One more important channel is this calcium. Calcium is also having role in release of, I'm just taking another page. Okay, now lamotrigine inhibits calcium channel, decreases vesicular release of neurotransmitters, specifically the excitatory one. Okay, remember this. Now, it decreases binding of vesicle to plasma membrane and decreases release. That is what you need to know. Okay. Now, after having a look at this, let's move forward and let's look into how things are happening. And after this, let's look into what are the clinical trials that has been done on this molecule and how it has been effective in various conditions. The first one that we'll be looking is the seizure disorder. Now, see, in seizure disorder, remember it has been definitely used for focal seizure, okay, as a monotherapy, as an adjunct, both. Okay. Now, it okay in instant release form. It is also used for GTCS, the primary GTCS. Usually, the OD formulation or extended release formulation is preferred. Okay, it is also approved for a condition which is known as Lennox Gastaut syndrome. Okay, remember this. Now, these are the main things for seizure disorder, main approval that you have seen. Apart from this, yes, there are other conditions also for which it has been approved. You know, bipolar depression. Remember the 4L, the first one being Lamotrigine for bipolar depression. The second L is lithium, lurasidone, and the last one is it's a new drug that has come into the market. The brand name is Nexluma. Can anyone recall what is the name? Lumateperone. It is lumateperone. So apart from lithium, this lamotrigine, you have other medications also for bipolar depression. You can remember it with the help of mnemonic of 4L. Now, number three, okay, it is also used for pain syndromes. I know it might sound very unusual, but this is the reality. Off-label use has been there for pain syndromes. What are the pain syndromes in which lamotrigine has been used? Diabetic, this neuropathy. Okay, it is also used for central post-stroke pain. It is also used for HIV-induced distal sensory neuropathy. Only one thing is that no consistent result is being observed in trials. Okay, that is one of the cons of this particular indication. Number four, trials are ongoing for ALS, amyotrophic lateral sclerosis. It is also going for Parkinson's. It is going for Huntington. Okay, all of you know that these are neuroinflammatory dis- uh, disease and disorder, and it being an anti-inflammatory agent, although it has not been approved, but trials are going there, not approved as of now. But this is how science progresses. Okay, now see. That is why I've included this particular article. Okay, this is from 2024, and you can see that multiple clinical studies have been included where they are looking for different things. See, they are looking for neuropathic pain. They are also looking for fibromyalgia, migraine, alcohol and ketamine addiction. Okay, for PTSD, for this should be ADHD. So these are the various other conditions in which this drug is in pipeline. So in might be in future, in coming times, you will be able to see that this particular agent got approval for these set of conditions also. Okay, now let's talk something about bipolar disorder. I have mentioned although the four L's over there, but in bipolar disorder, it acts robustly against depression. How? By delaying the next onset. Therefore, decreases chances of depressive relapse. It is also having role in RCAD. What is RCAD? Rapid cycling affective disorder. Now, rapid cycling. Remember, usually this treatment resistant form of rapid cycling is where this lamotrigine comes into picture. If you look into the data that has been provided at APA textbook of psychopharmacology and also in recent CTP, 50% of patients respond to lamotrigine. Okay, adding lamotrigine to quetiapine yielded benefits. Okay, they yielded acute and long term benefits. Okay, in those set of patients who were responding poorly to quetiapine, poorly responding to quetiapine. Okay, one more thing I would like to just add on, it decreases modestly, it decreases BMI. So modest decrease in BMI is noticed. Might be having role in coming days for obesity. So all these five